Welcome back. I'm Mabel Jong, and you're watching continuing coverage of the World Healthcare Congress here in Washington, D.C. In our studio today, Craig Lack. He has been described as the most effective healthcare consultant that you perhaps have never heard of, and that's because he finds loopholes. I read that in an article. You can tell me now if that's true.
That's right. The journalist who wrote that for Inc. was, let's just say he was being provocative, because loophole kind of infers that maybe there's some gray to a strategy or not, and really the strategies that we've talked about here today are all black and white for employers.
Okay, so let's talk about the black and the white.
Yeah.
What are the benefits that are available to employers today that are clearly good choices?
It's really simple. If you're going to control your healthcare and pharmacy claims, number one, you have to be self-funded. And if you're going to be self-funded, then the only thing that matters is the ability to control the frequency and the severity of your claims. Mm-hmm. Because as any self-funded employer or consultant knows, 90% of your expense on a self-funded medical plan is either directly or indirectly related to your claims experience. So real simple rule of thumb for employers out there, for buyers out there, HR directors, total reward CFOs, one simple question: how does this tactic or strategy reduce the frequency or severity of my claims this year?
And that's guaranteed to save on the bottom line.
Exactly. If you're going to reduce the number, size, and frequency of claims, there's only one result: your costs will go down.
Okay.
Yeah.
Do best practices really work?
Oh boy. That's a loaded question. You asked the right guy. Do best practices really work? It reminds me of a story, right? My oldest millennial son taught me something a few years back, and he said, we were traveling, and I whipped out a paper map, and he goes, looking at me disgustedly, says, "Dad, does that thing update in real time?" I said,
Smart Alec.
No. He's like, yeah, get rid of that, right? And so I've used that story to describe healthcare, right? So the Affordable Care Act, like it, don't like it, it has been the catalyst for thousands of experiments in healthcare. The results are, literally, I live on a plane, I travel all over the United States working with consultants and employer groups, and so I see all these different experiments that have taken place around the country. And so you have all this change, literally, depending on what market you're in the United States, it's every month, it's changing. So if you're still using paper maps to find your direction, like best practices, what I call legacy best practices, then it's no surprise you're lost.
Okay. So, but you referred to legacy best practices.
Yeah.
Are you talking about disruption and coming up with practices that could be very good?
Yeah, so in the meeting here, when you get educated and you expose yourself to the new things that are going on, then those can be innovative and disruptive. The fact of the matter is there's a lot in our industry that are called best practices that are really years and years old. They've just been branded by somebody with maybe a national footprint, who blesses it, brands it, and says, this is a best practice.
Right. Now, what are some of the other takeaways that you really want to leave with attendees at this conference?
Control costs. You must be self-funded. If you're going to do that, it's a very simple equation. It's no different when I talk to CFO groups and I ask CFOs, how many here have a vice president of supply chain? Everybody does. So I said, so think of healthcare in the same way. Might be a new thought for you, but it's nothing more than supply chain management. The difference is it's the medical supply chain. So if we look at hospitals, ambulatory surgical centers, physicians, and pharmacy, that's 90% of your claims. So anything that can interact and negotiate and reduce the cost related to the medical supply chain, hospitals, surgical centers, physicians, and big pharma, is going to help you control your costs, which means there's no more trend increases for companies who know what they're doing. For companies who have expert consultants, they don't have trend increases, okay? That's for the people who want to use more legacy best practices, like what I call benchmarks. For the average employer, benchmarks are nothing more than an echo chamber so that people can compare themselves to other people who don't know how to control their costs. And so they appear to be doing less bad than someone else.
Okay. Craig Lack.
Supply chain management. That's what it's
Supply
all
chain
about.
management. All right. Last words here. Thank you so much, Craig
Thank you,
Lack.
Mabel. It's a
Thank
pleasure.
you. And I'm Mabel Jong. Thanks for watching. Stay tuned.